Question is going to talk about the fact that it's projected that the state will not be able to reimburse our doctors or pay for medicine for Medicare patients after March 30th, 2011. If this shortage is not remedied, what proposals do you have in mind that will allow services to continue despite a lack of funding? And we're going to start right here with Councilman Stewart and just go straight down.
Good. Sounds good. I think the answer to this goes back, and I'm sure we're going to talk about it perhaps in a minute, but goes back to a restructuring of our tax system, of picking up some revenue by doing away with some of the tax loopholes that we have, by a complete overhaul of our tax system, so that we have the money to pick up these bills, because we should and we have to continue, in my opinion, as a society, we've got to care for one another, and we have to provide health care, and we've got to figure out a way to do it, and no stone can be unturned, and currently there are several stones that we're going to have to step over to do that.
I agree with Dwayne on that. I think not reimbursing doctors for their services and not paying for medicine for our poor citizens should not even be an option. I think that we're talking about in March, and we knew this even a couple months before now. So somebody should have been working to make sure that that doesn't even happen. And so I think that we need to make sure that we find a way to fund these programs, and interrupting these services should not be an option. Again, I said we have some of the highest stats when it comes to poor health conditions, and we have to make sure that we address those. And it's kind of strange because we keep talking about cutting Medicare, and I know the budget is tight, we have to cut something. But we get $3 from the federal government for every dollar that we budget for Medicare. And so every dollar we cut is $3 that we're not going to get. So I think we need to look at the budget realistically and realize that we have some core functions that we need to provide, and I think healthcare is one of those, and we have to look at other things that are not as important to cut, but not reimbursing doctors and not providing prescription medicine for those who can't afford it shouldn't be an option.
I would propose a bill that would generate funds for medical expenses. We cannot allow greater human suffering to take place. A bill must be passed to raise funds so that doctors could be reimbursed for their much needed services.
We're going to go right back to you,